Thank you so much for joining me again on Aesthetically Speaking. And today we are going to talk about some serious stuff. So if you are a person who laughs, coughs, sneezes, and has urinary incontinence when you're doing those things, lifting, running, jumping, dancing, then you need to listen up. And we're going to talk today about the O shot. And no, it's not a drink. It's a procedure that will bring a lot of joy to many, many people. So, Dr. Nicole Kanaris, could you please explain to us what the O shot is?
Yes, I'm so happy to be here today, once again, chatting about something that I'm really passionate about, women's health. I think at the end of the day, there are so many things you can do for a man because you can physically see the problem, you can physically see the results, so then it's taken as a problem. With a woman, it's not a physical problem, people ignore it.
Yeah.
So what is the O shot? It's the trademark procedure developed by a doctor in Alabama. His name's Dr. Charles Runels. And what he did is something unorthodox. He decided, I'm using PRP, which is platelet rich plasma, and I'm using it for so many other procedures for regenerative purposes. What happens if I inject it into the vagina? So he took his receptionist and he asked her, would you like to be a guinea pig? He was at that stage in a relationship with her. And he said, let's see what changes you feel. Yeah. And their sex life bloomed after that. So what is PRP? Platelet Rich Plasma. It's taking a person's blood, just like a blood test, a single vial. It's then put in a centrifuge, which is a specific machine that allows the blood to spin at a certain speed, and it separates the blood components. So blood is made up of red blood cells, white blood cells, platelets, and plasma. So the platelets come to sit in the plasma part, and they're separated by the red blood cells. And platelets are rich in growth factors. So you'll remember if you fell as a child and you had that hectic scab on your knee, and then suddenly you bent, and the scab kind of came apart, and it was yellow, gold stuff oozing from it. So underneath that gold stuff was causing regeneration, healing the skin underneath. So if you inject it, say, into the face, it regenerates the skin. If you inject it into the vagina, it increases blood supply. It puts collagen in that area, tightens that area, improves the nerves and the sensation, tightens the muscles. So it does a whole host of things, and it can treat a variety of different things. You mentioned stress urinary incontinence, which is exactly what you said. You're jumping, you're doing your Pilates class, whatever you're doing,
yes.
Reformer, rebound, and suddenly you feel, oh, I'm clenching, but it's still leaking a bit.
Yes, or going to the toilet many times a night instead of getting your deep sleep and being interrupted by the fact that your blood is bursting.
That's exactly it.
So it might be from, having gone through childbirth, or not doing exercise, or what are the other reasons why you would have this incontinence?
So generally they say if you have a strong pelvic floor, you won't have urinary incontinence. So it's maybe patients that do need to work a bit on their pelvic floor. There's certain exercises you can do for that. But yes, childbirth does add to it. And even Caesars. I mean, it doesn't mean just because you've had surgery to remove your baby, there wasn't that pressure on your bladder from the whole pregnancy. So a lot of women. And then why this? Because you can have surgery for a prolapse.
Yes. So you could opt for the surgical thing. But I mean, as women, we first of all don't have time because we put ourselves last. We say, oh no, I can't take time off to have this surgical procedure to help me. I'll do it later, or I'll do it when the kids are all grown up or whatever. But meantime, you could, and then the sexual health goes for a ball because you're not, it's it's 2 in 1, isn't it?
Yes.
So this O shot, you could be addressing multiple issues in one go. But hold on a second now. You did say injecting into the vagina, and I know a lot of people are going to run away. Don't. Wait. Is this procedure pain-free?
So I want to go back to one thing before we even say that.
Mm.
So it depends on the degree of your urinary incontinence. Some patients will require surgery. So, I mean, if you've got a hectically prolapsed bladder, you need to be seen by your urologist. We are not saying that there isn't a place for surgery. And we work with a lot of different other health professionals to assess the patient. First, to see if they're a good candidate. We have a very long questionnaire, and we sit with our patients for a long time to see that they are a good candidate for the procedure. But I've had patients who've had slings before, had surgery before, have had to have it multiple times, and they do one O shot and it makes the world of difference. There's also those patients who are in their 20s. They want to have a child. And if you've had surgery, it may make it a little bit more difficult for a vaginal delivery. So for those patients, an O shot would work. Pain-wise, I do it on this very bed. There is literally, we put our local anesthetic cream. We can inject our local anesthetic into the areas we want to inject if necessary. But generally, our patients feel very little.
And the best thing is that you drive yourself here and you can drive home.
So it's literally lunchtime. Yeah. It's probably more simple than having a facial peel because you're out in the open, no one knows.
So there's no downtime.
No downtime.
Just come in, take the blood, spin it. Oh, but let's talk about blood now. Surely
yes.
The patient has to be in relatively good health. So perhaps, if you know that you're going to have this procedure done, perhaps 2 weeks before, having a look at diet, having a look at how you are.
Without a doubt. I mean, if you want something to regenerate in your body, you want your body's full attention to that specific area. So if you've got flu or another infection, rather wait it out. Also, there's certain medication that you shouldn't take before and after because we are basically harnessing your body's inflammatory response. And now, if you remove that inflammation, so if you're on cortisone, if you're on anti-inflammatories, you won't have the result that you want. So those products you stop. But also with regards to diets, being healthy is always a good thing.
Yes.
Being healthy, eating healthy, exercise, those are all wonderful things. But it's not going to affect the outcome if in the last 2 weeks, say, you were eating unhealthily. But the medication will 100% affect your outcome.
There are just a few things I want to address as well. We spoke about urinary incontinence, and we spoke about all those things, but we didn't speak about decreased sex drive, dryness, ability to orgasm. We didn't speak about is it lichen planus and lichen sclerosis?
Lichen sclerosis, yes.
Which is really an itching and just tissue not being great.
Yeah, so it's quite a sad disease where patients have like abnormal skin in that area, and it causes a lot of itching and then scarring in the area. So people will be out and they just have this uncontrollable urge to itch. So you can imagine being in public. So
yes.
People don't stray from their houses because of this.
Usually doctors, what do they prescribe for that? Is it an ointment?
Yes, cortisone cream. So for that procedure, we would need to have a definitive diagnosis by a dermatologist or a gynecologist to know what we're dealing with, because we need to make sure it's not cancer.
But otherwise, the O shot would address.
It does.
It would improve that condition.
So we've had almost normalization of the tissue in that area from actually treating it with PRP. And so we would inject into the area that's problematic and around that skin. Sometimes there's so much scarring in the vagina that patients can't have sex because it's just tearing. It's a horrible disease. So this does help quite dramatically.
So, in one procedure, and this is what we love as women, is a 3-in-1 or a 5-in-1 or, multiple benefits in one procedure, where that would improve, not only would it improve your incontinence, but it would improve your sex life in terms of just the everything about it. In terms
your libido, dryness in the area. A lot of patients have pain, so it helps with the pain. It helps with sensation, so you feel a lot more. We also have a lot of patients who've never had a vaginal orgasm.
Yeah.
So they're able to climax on the outside, but not on the inside. And so we improve the blood supply to that area, and they really do. They're able to climax internally.
And Dr. Nicole, I believe you are registered to train other doctors in the OSHOT in South Africa. Is this true?
Yes. So I did some training a couple of years ago in Beverly Hills and trained to be the official trainer for doctors in this trademark procedure in South Africa. So we have successfully trained quite a few providers, and we have 3 doctors in our clinic that all perform the OSHOTs. And yes, so it is good to go to someone who's been appropriately trained. And
what about gynecologists? Are they open to coming to the training?
so it's such an interesting thing. I've had gynaes that have come. I must say they're the more open-minded, younger gynecologists that are aware of kind of regenerative medicine as such, because a lot of gynecologists are more old school. They come from a place of, we cut, we can formally see and we have results. They can't understand this whole concept of your body regenerating itself.
Yes.
It is a difficult one to
Once
see.
you get to a certain age, like my age, in your 50s and 60s, you kind of, it's over kind of thing.
No, that's
and it's not. No, I'm not saying that it is, but it's that's the kind of the old school kind of thing, that it's your lot and you're over the hill and whatever, and that must all, it's just part of nature to not have a sex life, and it's
sad.
It's sad.
So I think there's that thing of, there's a lot of patients who are menopausal, who cannot go on estrogen, cannot go on hormone replacement therapy because of cancer risk, breast cancer risk. There's also patients who have had breast cancer who can not go on hormone replacement therapy, or due to certain medications that they've taken, cause dryness and pain during sex and reduce their sex drive.
Okay. In fact, that was my next question. Were the candidates that aren't really, that they are not taking HRT, and would they benefit from?
Yes. So it really works wonders for lubrication in the area, which we know diminishes when there's less estrogen. Also, the sex drive goes down during that time, so it helps to improve that, and also your sensation. So on those fronts, yes. And we know that sex is a part of a healthy marriage, a healthy relationship, and well-being. So you do want
just overall good health.
Overall.
And then, because we are very much an instant gratification, type of people, how long before you see, the results, or just come to feel the benefits of the OSH?
So it's quite variable. It can take up to 3 months to see the full results. I do find with most of my patients, it's the stress urinary incontinence that they see the biggest difference in quite soon, and then a little bit longer with sensation and lubrication.
Yes. Okay.
But it takes about 3 months for the full results, because it's regenerative. It's your body building. And then it lasts up to 3 years. Up to 3 years.
So I was that was my next question, was how many should you have? How many procedures should you have? But is it 1 or 2 a year, or?
So it would depend on your need. If you've got lichen planus or lichen sclerosis, we may need successive treatments, even monthly, 3 to 6 sessions before you see a change in the tissue. But we're dealing with an active disease there. So it's almost like we're trying to reverse it.
Yes.
Okay. And then with like your urinary incontinence, if it isn't severe, sometimes one treatment and you're good to go. We also have diabetic patients that are so prone to thrush. And we found that the O-shot has helped them be thrush free. So one O-shot and they're free. One of my patients was thrush free for 18 months. So that was a life-changing thing for that patient.
And also remember, you're using your own body to heal itself.
So one of the most popular things is we do have an influx of patients who are very healthy. They're vegan. They don't want to be putting substances that are not from the outside or harmful or chemical based. And so this is why this procedure is so wonderful. We take your blood. We then inject your blood back into the area of concern. And so we're not using anything foreign.
But just make sure that you do your homework and you go to a registered doctor, because you need to be in a sterile environment when you have procedures like this done. You're dealing with blood.
Yes.
Right.
Yes. There was actually an issue not too long ago in the States. It wasn't with the O-shot. It was actually with a vampire facial, where patients were going to a specific clinic and they were reusing the needles. And two of these patients got HIV. So it's the same like when you pick your barber, and they shave your head and there's a little nick and they don't clean that blade. You are at risk for most likely hepatitis. So make sure you go to a registered medical professional for these procedures.
All right. So it's a lot to take in, but it's all good. And I hope you enjoyed learning as much as I did. Thank you, Doctor. Thank you again for joining us on Aesthetically Speaking.
Thank you so much for having me. I really enjoyed it.